Welcome to Docs on Call, brought to you by Methodist Medical Center, with your host, Gina Morse.
Good evening. Whether you're a weekend warrior who enjoys hiking, biking, and running marathons, a high school student who is training for football, soccer, or cross-country season, or someone who just does a lot of repetitive, labor-intensive work, then you'll want to pay close attention tonight as we discuss sports medicine during tonight's Docs on Call. And you can get your questions answered by experts from Methodist Medical Group when you dial 698-3742. That's 698-3742. Each year, about 1 in every 25 people will seek medical help for a sports injury, but not all of those injuries are sustained while playing sports. So, let's meet our experts. And you know our first guest as the sports doc, Dr. Chris Miles of Methodist Medical Group at Washington, shares a tip each week during Lee Hall Sportscast. Welcome to Dr. Chris Miles. And Dr. Jill Wirth of Methodist Medical Group at Peoria. That's on the northwest side of Peoria. She'll be taking your questions as well for the next half hour. Welcome to you both. And by the way, also online tonight, Dr. Brandon Bakowitz will provide answers to your questions in that live online chat. All you need to do is go to mymethodist.net. So that's mymethodist.net. And thank you all again for joining us. Let's get started by talking a little bit about what you do in sports medicine. How is your specialty different than, say, an orthopedic doctor?
Sports medicine in the primary care setting, which Dr. Wirth and I are both trained as primary care sports medicine, is non-surgical sports medicine. So injuries, sprains, strains, all those injuries that don't ultimately need surgery, we're trained to care for. In addition, prevention of injury, exercise as medicine, exercise prescriptions, nutrition.
We also do some things, including fitting folks for splints, casts for some uncomplicated fractures that wouldn't need to be followed by an orthopedic surgeon. In our practice as well, we interpret our own x-rays for injury evaluation. Just a few of the other things that we do that we can provide our patients with care for.
And non-orthopedic things, concussions, heat illness.
All sports related, especially this time of year.
Absolutely.
Absolutely.
Okay, and your typical patient, who's your typical patient?
Oh, go ahead.
It really varies. I think probably the high school athlete probably most commonly we see, but we also see children as young as 5 or 6, 3 or with fractures. We see patients in their 60s, 70s, and 80s with arthritis. So I don't know that there's one typical patient. We joke in primary care sports medicine that we try to get every person is an athlete. We try to get them back in the game of life, and that's and really, so there's not a
great way to look at it. Yeah. And we should mention that, as you said, that these are not just questions that we want to hear from athletes. Everybody out there, give us a call about what concerns you have, and maybe you're one of those people who is doing a lot of repetitive motion in their daily workplace, and so I'm sure that you guys could help out answering a few questions that way. We're already getting some calls in. Knee pain with the left kneecap. Well, and I can relate to that. I can say that probably a lot of St. Jude runners this weekend would relate to that. What they can do to relieve some of that pain, what would be your advice?
Well, initially with injuries, if it's an acute injury, we always talk about icing. We think that ice is one of the best pain medicines that there was ever invented. And we use ice 20 minutes at a time, especially to keep pain away, to keep swelling down. It's a great way to help that injury in its initial stage.
One of the mnemonics that we use a lot of times regarding acute injuries is PRICE. And what that stands for is protect, rest, ice, compress, and elevate. All of those things, just as Chris alluded to help bring down that initial swelling, inflammation, and see if the injury can kind of heal itself with just a brief bit of time.
And we'll come back to that mnemonic device here in a moment. First, we want to hear what Becky has to say. Becky, you are watching Docs on Call. What's your question?
Hi, my question is, I was overweight, about 60 pounds overweight, and I have lost about 45 of it. I still have about 15 pounds to go. I have found over about the last 4 months that I really enjoy running, but I have found that I have pain on the left side below the knee. And it has gotten to where I can't, I was doing up to 5 miles a day, and I can't run that distance anymore or at that speed. And it hurts mainly in the shin and on the inside of the shin and the muscle. And I ran at about 5:20 this morning. I ran for about 3 miles, and I've been limping most of the day. And just over the last few months, it's gotten progressively worse. Do you have any ideas of what this might be, or what I could do to alleviate this?
Sure. Well, first of all, congratulations on your weight loss. That's fantastic.
That's really Thank you very much.
What you're describing sounds like lower leg pain, not necessarily in your knee. Is that correct?
Becky, did you hear that? Is the leg pain really in your knee, or is it lower leg?
Oh no, it's not in the knee. It's actually in the shin. It's to the inside of the shin and that muscle.
Very good. What it sounds like you're describing is a condition we call shin splints, or irritation of the muscle and bone at that front part of your lower leg. Some of the things, like we talked about earlier, icing, first and foremost, is very important. Stretching. And then possibly being evaluated for your foot structure and any gait abnormalities or your running form that may set you up for pain.
The other thing too, Becky, is to perhaps be seen or see your physician regarding what types of shoes you're wearing. If you're wearing not properly cushioned or padded shoes, that can change your foot mechanics when you're running. Sometimes running, if it's only one leg that's affected, sometimes if you're a road runner, because of the camber of the road, one leg is kind of relatively longer or shorter than the other when you're running, and that can put an additional stress on that one particular leg and cause some pain as well.
All right. Well, Becky, thanks for the question. We've got Karen on the line now. What's your question for us?
Yeah, my husband is a runner, and a lot of times he's running on the treadmill. He's starting to have numbness from his mid-back down both legs when he's running, and then usually once he does stop, it takes a while for that feeling to come back into his legs.
Wow. Yeah, and there is a big difference between running on pavement and running on a treadmill.
Absolutely.
What can he do to maybe relieve some of that numbness?
My concern would be having him evaluated for something regarding pathology in his back. I don't know that the pain is necessarily from the running itself in his legs, but rather something that's being compressed in his back and perhaps pinching a nerve or something to that effect, and that pain is radiating, especially with it being on both of his legs. So my recommendation would be to be, again, seen by your physician and possibly evaluated for something of that nature.
I agree. Anytime somebody gets symptoms down both legs can certainly be concerning and something that needs to be looked into.
Okay. Thanks for the call, Karen. Lyle called in with this question. Has a granddaughter who has a torn meniscus and was told by docs that she can't do much activity. Do you think that is an accurate thing to tell his granddaughter? Worried about her, but obviously wanting for her to be active if she can be.
Go ahead.
Well, I would say it would kind of depend on which types of activities she was involved in. Obviously, anytime you have a tear in the meniscus, some running, jumping, a lot of compression activities could make that meniscus tear worse. Twisting, pivoting type of motions can also kind of exacerbate that injury. Things like elliptical machine may be something that she could be doing without a lot of impact on that knee, as well as bicycling. You have to be careful. A lot of upper body type of things would be available for her to participate in because they don't rely on that shock absorber in the knee.
Right. Okay. Jackie's on the phone now. She's got a question for us. Jackie, thanks for watching Docs on Call. What's your question?
Hi. About a year ago, I had a right hip replacement. Since that time, I've had physical therapy, and things went very well. But just recently, I've developed an unsteady gait where I have a tilted pelvis, and I'm also rotating my right leg instead of walking front to back, I guess, so to speak. I've done therapy. I'm successful during the therapy session, but as soon as therapy is over, I'm still having a lot of low back pain. And I was wondering if you could suggest any other types of treatment.
Well, as we find, oftentimes physical therapy works wonders for all types of conditions, and the physical therapists make us as primary care sports doctors look really good sometimes. Their hard work at getting people healthy really is to our benefit. I guess one of the most important things that we try to stress to people after they've completed a session of physical therapy is you really have to keep up with those exercises that the physical therapists were having you do. Because the muscle strength and the stretching and all those things that go into physical therapy are vital for the condition to stay improved. You got to keep doing those, and so we really stress when you complete your physical therapy program to continue those exercises, and that may help you get back to your normal gait.
All right, let's hear what Tony has to say now. Tony, thanks for watching Docs on Call. What's your question?
Yes, I got burning pain like electricity going down my right arm to my thumb. And then here for the last 2 days, it feels like my whole right hand, my shoulder's on fire. And I got my arms and my muscles are all spasms, they're just jumping.
Let me ask you, Tony, how did all of this start, or what were you doing when all this started?
About 2 months ago, I got blown off my feet, and I landed on the right side of my body and injured my knee, and then about 3 weeks later, my nerve system in my right arm started acting up.
Okay.
Tony, have you been evaluated for this?
I'm working on it.
Okay. It sounds like potentially something from the shoulder itself. Sounds like you've had some nerve damage, as you alluded to. That can come from the shoulder itself, can come from the neck. And so I think that it would be in your best interest to see someone about, is there nerve injury at the level of the neck? Is there nerve injury in the shoulder or on down the arm? But certainly, I believe we'd suggest that you get that looked at. Anytime, again, that burning sensation, that really indicates to us that there's some nerve pain.
All right, get that checked out, Tony. Thanks for the question. Meantime, we've got Greg on the line now. Greg, what's your question for our doctors?
Well, I'm a 48-year-old male, and off and on, I've lifted throughout my life, and my right elbow is sort of, it almost feels as though it's chipped or broken. The left elbow is fine. It's, comes to a point like it should. It doesn't give me any pain unless I happen to lean on it at a certain angle. And I guess my question is this something that could be a function of the lifting, or could it be from some sort of a degenerative illness?
That's a great question, Tony. And to be honest with you, it's kind of hard to tell without being able to evaluate you. But definitely repetitive motions like with the weightlifting that you alluded to doing can put some micro stresses on your joints and bones over time, especially trying to do some of the maxed out weightlifting that some guys either try or have to do depending on their sport and training and things like that. So it could be a function of something like that. But unfortunately, also age, the more we do with our bodies, and the longer we live, the more stresses we put on them cumulatively as well. So there could be a component of a degenerative process going on in there as well.
Greg, thanks for the question. So some good advice there.